Welcome to the second video in our volunteer onboarding orientation series about the people we serve. The impact of vision loss. There's some hard facts when it comes to the impact of vision loss. Discrimination. Unfortunately, Canada is not yet an inclusive, barrier-free society in every respect. Many people with vision loss live in poverty as a result of discrimination and other barriers, so the social realities of living with vision loss are also a major concern. Unemployment. 2 out of 3 working-aged people with vision loss are unemployed. This is a result of stigma around a person's abilities and the additional personal costs of acquiring additional equipment and software. Change in relationships. Fear or discomfort of others may cause distance in friendships, fear they will no longer be loved, suddenly relying on others for help, possible loss of some relationships. Some favorite social activities may temporarily or permanently not be possible. Loneliness. Change in lifestyle may result in feelings of loneliness, difficulty meeting new people and making friends, accepting better than nothing relationships, feelings of social inadequacy, behaviors of withdrawing from social settings, feeling like they don't belong in certain settings, sometimes left out of social activities because of ignorance or discomfort of others, assumptions by others that they can't participate, strong feelings of being different, not understood by peers, lack of acknowledgement of abilities by others, discrimination, and negative attitudes. Stages of grief. It is extremely important for our volunteers and staff to have an understanding of the journey towards adapting and adjusting to vision loss, which in many ways is similar to grieving the process for a lost loved one. Emotional turmoil. Denial, not wanting to accept the reality of vision loss, pretending that they are not disabled, not accepting that some life changes are required. Anger, angry that this is happening to them, and feeling sorry for themselves, frustrated that what may once have been easy now seems very difficult, frustrated at having to relearn, change behavior, and frustrated by a lack of information surrounding vision loss. Fear. Fear that they will never be able to live as they did before, fear of total dependence on others, uncertainty about what is happening to them. Acceptance. I can't change this, my life will never be the same. Adjustment. I need to learn how to live my life differently. People who are born with no vision often don't go through these stages, as they aren't losing something. However, people losing their vision later in life often do. We can all empathize with this experience, despite not being able to fully understand it, as we've all lost someone or had a significant life change. After the initial emotional trauma, eventually people accept and then adjust to the new reality. Most common causes of vision loss. Vision loss can be caused by eye problems that are present from birth, by conditions that appear later in life, by infections, by injuries, or by environmental factors. The 4 most common eye diseases that cause vision loss are age-related macular degeneration, glaucoma, diabetic retinopathy, and cataracts. Macular degeneration. This is the leading cause of vision loss in Canadians over the age of 50. Approximately 1 million Canadians have AMD. It causes damage to the macula, which is the central part of the retina, responsible for seeing fine details, such as reading print or seeing faces. This causes blurred central vision with a growing central blind spot. Vision loss due to AMD is usually permanent and can range from mild to severe. People with AMD typically have some peripheral vision and almost never lose all vision completely. Risk factors include age, family history, being of Caucasian ethnicity, smoking, poor diet, excessive sunlight exposure, and obesity. Glaucoma. This involves damage to the optic nerve and is most often caused by high pressure inside the eye. Glaucoma is usually painless and has no symptoms. Most people do not know that they have it. It causes the loss of peripheral vision, tunnel vision, reduced night vision, and blurring of central vision in advanced cases. Early detection and treatment is essential to prevent severe vision loss. Risk factors include elevated pressure in the eye, family history, age, ethnicity, African, Asian, or Inuit descent are of higher risk, and myopia. When the optometrist machine shoots a puff of air into your eye, this is to check your eye's pressure and is one of the tests for glaucoma. Diabetic retinopathy. People with type 1 and type 2 diabetes are at high risk of developing vision problems. An estimated 500,000 Canadians have diabetic retinopathy. Elevated glucose levels in the blood cause blood vessels in the retina to swell and leak. New blood vessels may also grow, causing further damage. Without treatment, diabetic retinopathy can advance to permanent vision loss or even blindness, usually in both eyes. Risk increases with smoking, high blood pressure, uncontrolled high blood sugar, ethnicity, Aboriginal Black Canadians. A field of vision test in which a patient stares at a black cross and presses a button every time they see another cross in their peripheral vision is one of the tests for diabetic retinopathy. Cataracts. Over 2.5 million Canadians have cataracts. Cataracts develop within the lenses of our eyes. As we age, our lenses naturally harden and may turn cloudy. A cloudy lens blocks light from reaching the retina and interferes with vision, similar to looking through a dirty car windshield. Cataracts may form in one or both eyes at the same or at different times. Over 95% of patients have improved vision after surgery. Cataracts can be removed and vision can be restored. Risk factors include age, family history, diabetes, smoking, drinking alcohol, excessive sun exposure, steroid medication, and eye injury. Preventing vision loss. About 75% of vision loss in Canada can be avoided through prevention and treatment. Visit an optometrist regularly. Consider this: 250,000 Canadians are walking around with glaucoma at this very moment, and half of them, 125,000 people, don't even know they have it. Your best defense, a regular eye exam. You should also see your doctor right away if you notice anything unusual with your vision, such as blurriness, distortion, sudden eye pain, wavy lines in your vision, glare and halos around lights, difficulty seeing at night, flashes of light, or anything out of the ordinary. Get healthy. Research has shown that a diet high in fats and low in nutrients may increase the risk of developing age-related vision loss. Increase your intake of fish high in omega-3 fatty acids, fresh fruit, and dark green leafy vegetables as they provide nutrients and antioxidants that are healthy for your eyes. Keep active. Excess weight, a sedentary lifestyle, and high blood pressure are all risk factors for eye disease. Don't smoke. Your eyes will thank you. Protect your eyes. Exposure to sunlight is associated with a higher risk of developing AMD and cataracts. Wear a hat with a brim and choose sunglasses that provide at least 98% protection from ultraviolet UV rays. When playing sports or working with power tools, wear Canadian Standard Association approved safety glasses or goggles. Successful interactions. How you can help. Offer assistance. Don't be afraid to offer assistance, especially if someone looks uncertain. A simple, "Hello there, my name is Kinsey. Is there anything I can do to help you?" should do. Don't assume that someone can't do something. Speak normally. Don't change the way you speak. Using words such as look, see, or watch is not offensive. It is understood that they are part of everyday normal conversation. Put it back. Leave things the way you found them. Push in chairs, leave doors all the way open or all the way closed, and if you need to move something, let the person know where. For example, "Sue, I'm moving your coat so that I can sit down. I'll hang it on the back of your chair." Have empathy. Ask yourself, how would you like to be treated? Have empathy, not sympathy. Be patient, polite, respectful, and kind. Don't say, "I know how you feel." You don't. Don't discount their emotion by saying, "It's not so bad," or "Cheer up, it'll be fine." Thank you for watching this video. Please now move on to video 3 about volunteering.